Hello friends, my name is Manpreet Singh Dagan. I am working as a quality assurance manager in a company Technosys Software Services Private Limited. In this presentation, I'm going to tell that as an IT person, we got the opportunity to work in a healthcare domain projects. But before working on a healthcare domain projects, it is very important that we should know about the healthcare industry. We should know about there are some regulations and acts and laws in United States healthcare projects like Medicare, Medicaid, Healthcare Quality Improvement Act, HIPAA, Patient Safety and Quality Improvement Act. Then we have OCR laws, we have a ARA Act, and of course, like in this presentation, I'm going to cover the HIPAA part, and the other acts I will cover in the next videos, or you can say the next blocks. And what is HHS? HHS is Health and Human Services. The Department of Health and Human Services is the United States government principal agency for protecting the health of all Americans and provided essential human services, especially for those who are least able to help themselves. Okay, and in this presentation, there are other terminology that is very important to be known, like HIE. HIE is called a Health Information Exchange, which is defined as the mobilization of healthcare information electronically across organizations within the region, community, or hospital systems. Then we have EMR. EMR is called an electronic medical record, which is in a computerized medical record created in an organization that delivers care, such as a hospital or a physician office. And then a term is called EHR is very popular. So EHR is electronic health record, is a record in digital format that is theoretically capable of being shared across different healthcare settings in a form of HL7 message, XML, etc. And along with that, like I'm going to cover what is called a PHI, what are the titles in a HIPAA, what is the adherence to a security rules, what are a security incident procedure in for the IT guy, he has to maintain that. Then of course the enforcement rule and adherence to enforcement rule. What is HIPAA? HIPAA, Health Insurance Portability and Accountability Act, and it was developed in 1996 to make healthcare industry more efficient. And it was basically enacted with three main objectives. The first one is protect health information coverage for workers and their families when they change or they lose their jobs. Then, of course, the protects the privacy of individual health information. What is the disease we have? And then encourage the use of electronic media by standardize the transactions for transmissions of patient data to reduce healthcare fraud. What are the aspects of HIPAA? Before that, like where HIPAA is being used. So it is being used with the business associates, hospital, nursing homes, individuals, uh, of course the projects we are working like product certification, the services we are providing. So basically there are three aspects of HIPAA. The first one is privacy and security, which set the standards for the protection of healthcare information. Then we have a portability to transfer and continue health insurance coverage between employment gaps. Then accountability, it reduces the healthcare fraud. What is PHI? PHI is protected health information. It is any information in the medical record that set can be used to identify an individual and that was created, used or disclosed in the course of providing a healthcare service. So basically, health information which includes demographic information, individuals' physical or mental health, provision of payments, and then we have a personally identified information. So PHI in HIPAA, which includes 18 identifiers like name, addresses, dates related to individual, telephone numbers, fax numbers, email ID, sorry, social security numbers, medical record numbers, certification, license numbers we have, and then URLs, IP addresses, and the biometric identifier. What are the titles of HIPAA? There are like it divided into two titles and section which address a unique aspect of health insurance reform. Title 1 which is deals with portability, and title 2 which is focuses on administrator simplification. So in going slides I am going to tell about the titles. Title 1, it deals with portability. It actually prohibits a group health plan from restricting the benefits of plan based on a person's pre-existing health conditions. It allows individuals to carry their health insurance from one job to another without having a lapse in coverage. So in an insurance domain like Cobra Active, which is very popular, Medicare Active is very popular, and it is been this act is been introduced with related to which deals with the portability. Yeah, and Title 2 of HIPAA, which is known as the Administrative Simplification, which requires the establishment of national standards for electronic healthcare transactions for controlling the fraud and abuse within the healthcare systems. So basically it deals with 3 points. Who is covered, what information is being protected, how protected health information can be used, and PHI and this administrator simplification, it consists of following 5 rules. Privacy rule, then we have transaction and code set rule, and then transaction and code set rule, like it involves the transfer of electronic information for specific purposes, and and then we have the third rule, security policies. So there are 71 HIPAA security policies and procedure, which includes 60 security policies and procedures and required by HIPAA security regulation. Along with that, it has additional 11 policies checklist, and which forms and supplemental documents to the required policies. And then we have unique identifier rule. So unique identifier rule for healthcare provider, it requires the usage of NPI. NPI, which is called a National Provider Identifier, a unique identification number of 10 digit for identification on standard transactions. And then we have informant's rule. Yeah, in this slide I'm going to tell about the adherence to security rules, and in order to compliance with this we should have some administrative safeguards, like privacy officer is to be appointment, very limited to the employees have access to electronic PHI. Then we have a training part to handle PHI in the organization. Then we outsource companies to implement that, and then we have some continuation plan in that. Along with that, internal audits by the clients is very important. It has been done so that there is no breaching, and procedure for security breaches is been done. And then we have a physical safeguards, that introduction and removal of hardware and software from the network itself, like we cannot keep the files on the system. The most important is that adherence to security rules, that we cannot share the information or the passwords. We cannot share the patient information. Shared PHA is very used in as a rule in adherence to security rules. Enforcement rule. Enforcement rule consists of provisions for compliance to HIPAA rules, it opposition of civil money penalties for violation of the HIPAA simplification rules, and then we have a procedures for investigations and hearing for HIPAA violations. In this slide, I'm going to tell about for the company and for us, like what is the adherence to enforcement rule. For the company, of course, there is a loss of clients, loss of reputation. There should massive violation fines we company has to pay, and for definitely the employee who is doing that, there is a sanction policy, and then possible termination of employment on or contract, and then potential criminal charges is to be done. So this is like in HIPAA, it's not easy to work on a healthcare domain, but definitely we have to follow different rules and regulations of the company, and then who is working on the project, definitely he has to sign the indemnity bond. Legal action has to be taken if it is breaking that. Yeah, in this slide there are some HIPAA certifications. it's been done for the individuals, but even now there are some HIPAA certifications for the business. As you said, clients, they themselves like giving the HIPAA trainings to the people who are going to work in a project. So yeah, of course, like these certifications are very important, or it is very valuable for you if you know, so you also understand all these standards, acts and regulations for that. So I've mentioned the link of the HIPAA certification. You can go through these go through this URL and you will find that what are the other HIPAA certifications as well. Waste time. So I am going to like tell about 4 questions and answers so that you have more clarity about the HIPAA. Okay, the first one: what individually identifiable information is not protected by HIPAA? A provider's patient medical record? uh, I don't think so. A conversation between a doctor reception and a patient about insurance coverage? No, definitely not. uh, an employee's personal record? Yeah, it may be. A healthcare plan's claims data? No. So the answer is an employee's personal record, which obviously, like, what individually identified information is not protected by the HIPAA. Which of these is a good security practice? The options are: keep your workstation secure. Yeah, it's possible. Practice safe internet use. It seems so. Report security incidents and breaching. Hmm. Next one is lock your screen so that no one can use. Okay. Ensure the security of portable devices. And the last option is all of the above. So the answer is all of the above. Like all these points, which of these is a very good security practice, like working on that. The third question: the privacy rules permits use and disclosure of PHI for purposes of public interest disclosure without an individual's authorization in which of the following circumstances? The options are victims of abuse and neglect, law enforcement purposes. The third option is public health activities, and the last option is all of the above. So answer is all of the above. Now going to the next question: which of the responses is not considered a good security practice? Use a unique login and password? No. Log off before leaving a workstation unattended? Write down your password and leave it underneath your keyboard? The last option is don't install unknown or unsolicited programs on your computer. So the answer is write down your password and leave it underneath your keyboard. So these are the 4 questions related to that. So thank you very much. So I have mentioned the blog site of my the articles I'm writing, the bloggers in that, and then I have a LinkedIn. So it will be great if you please feel free to share your thoughts in the comment section, and also please do subscribe to my channel for the learning more. Hope this helps, and happy learning. Thank you very much.